So good evening and welcome to Wisdom Wednesdays. Today is the 37th session and our season 2 on Wisdom Wellness. And it's a great day for us women who started on this mission of a united Sri Lanka and the empowerment of our women here. We are a registered legitimate group as of this week. So thank you to all who have helped us get on this journey and move forward with us. Today's topic is on mental health and COVID-19. I'd like to introduce you to our regular wisdom ladies, Soraya, Fazana, and Selvi. With us today, we have a very learned and experienced guest, psychiatrist Dr. Ganeshan. We will introduce you to more of his accomplishments in just a moment. So having lost a very close family member and some friends, even the son of a classmate, to COVID this year, I have to be frank in stating that it's a really awful time, not just for me, my family, our friends, our colleagues, our country, and even the world at large. How do we even begin to comprehend what is happening, or even grieve as one should when you lose loved ones? In addition, domestic abuse has risen, women and children being at the brunt end of most of it. Food is scarce, money is scarce, quite frankly, emotional support is scarce in that others are grieving too. So how do you help somebody else along? Now I'd like to ask the ladies to say what this time means to them, very briefly before we move on to Dr. Ganeshan. Fazana, would you like to start? Fuzzy, you're muted.
Karen.
Okay.
Yeah, I mean, even for me, it's been really hard because for me as a person, I would miss a wedding, but I'll never miss a funeral and never, miss going again and again to that house and sympathizing and helping in whatever way I can if a person is ill and, during that whole process and or finding some help for them. And now it's surreal, actually. It's very surreal where, something happens and then you just hear the news and you can't even go anywhere near it. And it's like, I feel very inhuman, Carol. Yeah, it is very disturbing and it's very hard to get used to. Yeah.
Thank you, Fuzzy. Soraya, anything you have to add to that?
Oh, absolutely, because just this morning I had news of one of my very good friends. We were classmates. Her mother-in-law died. And being Muslims, and to know that they don't even get to say goodbye, they're taking the body to Batticaloa. So I don't even think life can ever be the same for any one of us. It's not just about continuing to live, but I think we all have to apply those brakes and continue to heal first. When I was growing up, I was told that, mental illness needs more sunlight, more candor, and more unashamed conversations. But I don't even know what to say anymore because the COVID has taught us, very startling lessons about it's not just our ability, it's our incapacitation that is astounding. And for me, as we do this program for women, by women, and I'm also aware, and which question I want to pose Dr. Ganeshan is that women are highly more impacted in this journey because even in the mental field, there are implicit biases. When a woman goes to a psychiatrist, she is diagnosed already as depressed and highly emotional. And 40% of women, there's a 40% risk of women being diagnosed more than men of mental disorders. So all these issues come to my mind, and it's a very challenging time, and I have to increase my meditation, increase my presence of not thinking so much. So yeah, so we will enter into this discussion, and thank you so much, Dr. Ganeshan, for joining us and offering your time and expertise. Thank you.
Thank you, Soraya. Selvi, would you like to say something, and then you can perhaps take the chance to introduce Dr. Ganeshan?
Thank you, Carol. Good evening, Dr. Ganeshan. and good evening, my fellow panelists. First of all, I'd just like to mention here that we are talking here about mental health and not mental disorders, because they're two different subjects, and we are talking about how wisdom healing can help mental health. The second thing is the situation today, or has been for the last 1.5 years, is something extraordinary, something that we in this century or maybe in previous centuries have not had. It is extremely unique, and we are facing a unique situation with this COVID-19 in which all forms of mental stress, panics, fears, anxieties, and restlessness have come into play. The recent panic due to facing a possible future with food shortages has given way to panic buying and rise in food prices, and had added further to the existing panic and fears of the disease and the contagion. The devaluation of the currency and the state of emergency being declared has heightened the nation's fragile position and spells uncertainties to one and all. These are suffocating times for people throughout the world. Firstly, it is the virus which is rapidly mutating fast than finding appropriate cures for it. Secondly, it is the impact of the virus. The impact of this virus lies in not what it does to your body, but the real impact of this virus lies in what it does to your mind. It lies in the deep stigmatization of the virus. So stigmatization of the virus has turned it into something more deadly, more destructive, and more demonic than what it really is. How the public realm, I mean, when I say public realm, I mean the international organization like WHO, the FDA, the USDA, and CDC, and then the media, the governments, and the medical community has whipped up this fear psychosis, which is crushing us all with a paralyzing lunacy of fear. This in turn is stoking mass confusion, paranoia, and terror among people. Now, what do we do? What do we do in this situation? We have to heal our minds, and that's why we are looking to you, Doctor. So, Doctor, let me look at what you can about your credentials, and I like to introduce you in detail because we are looking to you for answers for these very difficult questions. So, Dr. Ganeshan qualified in medicine, MBBS from the University of Colombo, and specialized in psychiatry, MD, psychology from the Graduate Institute. He currently serves as a consultant psychiatrist in the National Institute of Mental Health. He is also in the board of many international and national NGOs, including the Global Initiatives in Psychiatry and the Center for Human Rights Development. He has published books and articles in partnership with other authors and on his own on self-immolation, a common suicidal behavior in Eastern Sri Lanka, Asian models of excellence in psychiatric care and rehabilitation, psychosocial response to disasters, some concerns, and in the past, he has worked as a consultant psychiatrist in the teaching hospital in Batticaloa. And during that time, perhaps, he started the first GBV desk, gender-based violence desk in Eastern Sri Lanka, and networked it sufficiently to assist in setting up a database in Sri Lanka. Dr. Ganeshan, over to you.
Thank you. Thank you very much for those kind words, and thank you very much for Wisdom Women for inviting me to talk about the stress and COVID and how to cope with it. Yes, as you all said, I mean, these are very difficult times, and especially the women are taking a lot of stress because the COVID is on one side, the fear of COVID is on another side, and what will I do if some loved one gets it, and also how will I put food on the table? Unfortunately, ultimately it falls on many women to put food on the table, whatever may come. So this is putting a lot of stress on all of us, and as you said, especially on women. So what I would like to talk about is, how do we handle this stress? What sort of changes happen in us so that we can identify that, okay, I am under stress. I'm not coping that well. How to understand that? And then maybe give a few clues how we can manage that stress so that it doesn't harm us and it doesn't harm the people around us. So the stress is one of the things, again, somebody mentioned it. This is not unique to me or to my family. The whole world is suffering. So understanding that this is a global phenomena, everybody is suffering from it, is one way that we can try to cope with it. So when I'm under stress, what are the things I do? How do I change myself? Knowing this is very important because very often we are under stress and then we think and react differently. But unfortunately, most of the time we are not aware that we are under stress. Other people notice the changes in us, but sometimes we miss it ourselves. So being self-aware so that we can pick up when I'm under stress, when we are under stress is very important. So there are certain things that happen to us. Basically, our sleep patterns can change. The way we talk can change. We may be talking a little more rapidly and be more abruptly. So those are some of the changes that we can pick up early. Especially difficulty in falling asleep. When we go to bed and different thoughts keep coming to our mind and we find it difficult to fall asleep. And sometimes it can even be that we wake up very early in the morning and unable to fall back to sleep again. And again, having negative, unhappy thoughts coming to our head. So that's one of the early changes of stress. And also our appetite changes. Some of us would tend to overeat when we are under stress. And yes, during the COVID times, a lot of us have overeaten and put on weight, but that's not necessarily due to stress because we have nothing else to do. But it can also be a sign of being under stress. And eating less also can be a sign. So if we lose weight, then again, maybe we are under stress. One of the common behavioral change that we see when people are under stress is they become much more irritable. So we may behave in a bit more irritable manner towards some burst. Maybe our children very often get the brunt of it, or our spouses. So our patience run low. So we become easily drawn into arguments and shouting and being blunt. So when these things happen to us, these are signs that we are facing stress. Of course, there are bodily changes also. So people having diabetes, the diabetes can go out of control. The blood pressure can shoot up. Asthma and allergic reactions can become worse because when we are under stress, we do secrete more what are called stress hormones, and they produce changes in our bodies as well. So these are some of the changes that we can notice when we are under stress. So it's very important that we pick it up, because as you see, these things, if you don't deal with it, they can lead to, much worse consequences. They can damage our relationships with our spouses, children. It can damage our health. And it can even lead to like mental health disorders like depression, anxiety, if we don't look after our mental health and look after our stress levels. So what are the things that we can do to help us not to go there? How can we prevent ourselves overwhelmed by stress? One thing very important that all of us can do is to manage our social media space. Hearing bad news all the time about this number of people have died in this hospital, this number of people have been infected, and unfortunately we also have news alerts in our mobile phones. I mean, it's good that we know that what is happening. It's very important that we know what's happening. But having a constant stream of unhappy messages coming to us through WhatsApp groups or news alerts or whatever, Facebook or whatever, is not a very healthy thing to do. Maybe we can look at the news or whatever news feed we are having twice a day or maximum thrice a day. Spending more time with these kind of a negative news items and fearful news items. And unfortunately, half of them are not true as well. And then we get worked up and then somebody says, hey, that message is not true apparently, or something like that, right? And by the time we have stressed ourselves out, we are worried, we have been thinking all right, and all for what? So managing our media time, social media time especially, is very, very important, right? And also managing our sleep. Now that has been another problem during the COVID times. Very often most of us are going to sleep late. And because we are not working or we are working from home or kids don't have to go to school, we are getting up late. And that is very unhealthy. Human beings, unfortunately, our brains are wired to sleep at night, right? And our brain produces a chemical called melatonin, which regulates our sleep pattern, keeping with the day-night cycle. So if we don't sleep at night and compensate it by sleeping during the daytime, does increase our stress levels, does play havoc with our hormonal levels. So preferably not to do that. Another important thing we can do is healthy eating. Again, it's very important. Now with all sorts of food delivery and food at home, and we are staying at home. And one of the few things that we can do is to cook and eat food. And very often it ends up being very unhealthy. And as we all know, food plays a very important role in our mental health. And so eating healthily is very important. Other one is exercise. When we exercise, certain endorphins are released in our brain, and they help to manage the stress levels a lot. I know it's very difficult during lockdowns, during the COVID times to exercise, but we have to find creative ways of exercising. I mean, skipping is a very good exercise. Climbing up and down a staircase is a very good exercise. So we need to add some exercise in our regular lives. That's again very important. The other important thing that we need to look at is relationships. How to keep healthy relationships. Unfortunately, in most of our homes, relationships tend to be more negative than positive. It can be with our children, it can be with our spouses. Most of our communication is don't do that. Why are you doing that? Why did you do that? Don't you know you shouldn't do that? I mean, these sort of communications, which doesn't foster a good relationship. So making sure at least 50% of our communication is positive, helping them to build up their self-esteem, not criticizing, and that is very important. Because especially for children, it's very difficult for them to connect with their friends and colleagues because they are not going to school. Yes, they are connecting a bit through social media and other things, but especially for small children, going to school is very important. And so putting negative children again and again during these difficult times is very bad for their mental health. We need to come back on us as well, because with whom can they put out their emotions? So it's very important that we make sure that we have healthy communication. And when we are stressed, when we are irritable, learn to leave the place or find a way of reducing the harm by negative communication. So for all of this, one of the important things that we need to do is to connect with our emotions. I need to know that I am not in a good mood. I am in an annoyed mode. I am in an irritable mode. I am in an angry mode, so that we can manage it without producing more harm to others and ourselves. So this is a good time for us to learn to connect with our emotions and learn to manage those emotions. So I will stop with that, and so that we can have time for more questions and answers.
Ganesh, and I think we can ask some specific questions of you. One of the things I have heard is people saying they need to take anxiety tablets because they feel very anxious. And I have felt this myself. Sometimes I wonder whether I have got COVID just because I have a little bit of a itch in my throat. And actually my son explained there's apparently a term in medical jargon that you use to describe it. It's like, you know, somebody else's symptoms, you suddenly acquire these symptoms yourself. And then you have to tell yourself, listen, I haven't seen anybody outside, I haven't been outside, and you have to start rationalizing to take away the fear. So either that or you have to take anxiety medication. What do you have to say to that?
Yes, I mean, medication has a place in anxiety when it becomes extremely overwhelming and the person can't just function at all. Sometimes the anxiety can be so much where it completely freezes out that person, or it freaks out that person, want to run away from the home, can't sleep at all at night, unable to communicate, they can become mute. So in those instances, yes, medication has a role. But like you said very rightly, using our brains, using our rational brain to work out our anxiety. Okay, I'm feeling anxious now because everybody is fearful of COVID. And so this is a normal fear I'm having. So just because I'm scared that I'm having COVID, I'm not going to get COVID by that, right? So even if I get COVID, so what? Most of the time, it's going to be a mild sore throat. I mean, most of us are going to get COVID and recover without having any symptoms. It's a very few who get very sick and who are in intensive care units. But unfortunately, it's that small number that we hear about, right? So understanding that, logically working out our fears, just like what you said, is a very sensible way of managing it. And also doing the other things I said will help us to kind of manage these stresses more logically. Yeah.
Thank you, Dr. Ganeshan.
I have a question. Yes. So Dr. Ganeshan, you pretty much answered every question I had in mind. The crux of what you said is that self-care and self-aware. So I'm not every one of us have that sense of mindfulness, but I hear what you are telling us to do. So let's say, having done all of that, what is the duty of our country and our government towards its people? Because every time we are told, you behave, you become better, the problem will aggravate. But what is the duty of the state towards the people? Like, for instance, particularly coming from a Muslim perspective, I mean, I know so many of my relatives, they didn't even get to say a proper goodbye. Their dead was taken hundreds of miles away to be buried. So that is one thing, but maybe that kind of rule was necessary. But the political, the inability of the political situation, not only in Sri Lanka, world over, most countries and leaders have failed, undermines public faith. That's a huge another track of issues that we deal with. Hospitals are overrun, we were not ready. People are divided, conflict, who should get the vaccine, who shouldn't, communal tensions, as I told about. What can we expect from our government?
Yes, I mean, all the government should work on giving consistent messaging, right? That's very, very important. So even the lockdown, everything, unfortunately, I mean, as you very well said, not only in Sri Lanka, many of the countries, you have people telling different things, right? So there was a time when your president was telling one thing and your FDA was telling us something totally opposite. That's very confusing for people. So coming out with a consistent messaging is very, very important. That is one. And then cultural competence. Before decisions are made, Though we try to think that Sri Lanka is one culture or US is one culture, it's not. There are lots of subcultures within the overarching culture. And developing cultural competence to understand how different cultures are going to get this information, how are they going to use this information is going to be very important. For example, the example you gave about denying Muslims the burial has caused a huge problem because many of the Muslims are the ones who have not got the vaccine. And unfortunately, they are affected a bit more than the other communities in Sri Lanka because of this whole stupidity over, this cremation issue. And that's going to affect not only the Muslim community, the whole country. So having cultural competence to understand how important these things are for the different subcommittees, sub-communities within the country is very important. And then stigmatizing COVID. This has again, I don't think Sri Lanka has done a good job of it. We have stigmatized people having COVID. And so when the government does it, the communities also pick it up. So because of that, when somebody gets COVID, they are worried that their neighbors, their relatives are going to look down upon them. And so then to hide it, and they keep it and they express having fever, etc. So people are very reluctant to go for testing. And the government has to take some responsibility for creating stigma for the infection and making people to hide. So these are some things that are not very healthy. And the same things we did with tuberculosis, leprosy, just increasing stigma will only make the spread of the disease more. And the same thing with mental health as well. So working to reduce stigma is what government should be working towards. But yes, like you said, many governments have made a mistake, but some of them are correcting it now, and we are moving towards better management. Hopefully sanity prevails.
Thank you.
Farzana?
Yes, I have two questions. One is, how does young families deal with their little kids of different ages who have no socializing, always stuck in front of a computer the whole day studying, and no sports, no hobbies. So we had such a vibrant childhood, and now it's not like you think it. Earlier you thought it's just 3 months, 6 months. Now it's almost 2 years, and so that seems to be something like people out there would really like to know any little tips in how we can cope with that. And the other is the shop owners, single daily wage earners, and even those who are working, some of them in certain sectors have lost their job, so they've had a huge hit on their finances. And this can lead to mental health because they are thinking every day how to cope with their day-to-day pressures, and it's the given, right? If they don't have the funds, I mean, they some resort to suicide. Even our farmers, traditionally, when they get into the debt trap, we found a large amount of farmers commit suicide, right? So these, I feel, are potential risks even in middle class to low middle class societies. So I'm wondering if you have any advice on those two polarized questions. Yeah.
Okay. So coming to your first question, yes, I mean, children are finding it very difficult, and very often they don't know that they are under stress because they are children, right? Even when adults are suffering to cope with it. So one of the important things that we need to do first is not to take our stress out on our kids. When we are in a bad mood, very often the children bear the brunt of it. And not to do that, right? It's very confusing for them, and they can't make sense of it. Why mama is shouting at me? Why dad is screaming at me? It's very difficult for them. So make sure that we have other healthy ways of working out our stress, healthy hobbies, yoga, etc., and not shouting at our kids. That's very important. To make sure that we spend time, create specific time spaces to spend with our kids, right? So in a way, this is an opportunity. Remember, before the COVID, we were working, the kids were going to school and classes. We hardly had time for each other. Maybe 5 to 10 minutes over a meal, we may talk something, but that's it. You know, take your books, what was your homework, and we get into that. So this is, in a way, a wonderful opportunity to actually build up our relationship with our kids. So when parents come with small kids, I ask the kids, so your mom, she's good at bowling or batting? And the kids look at me in a funny way and say, what? Your mom is good at bowling or batting? That's what I'm asking. And they look at me in a funny way and then look at their mamas and they say, I don't know. So enter the child's world, right? Use this opportunity to play games with our children that they like to play with, which is extremely healthy for us. The children can be extremely therapeutic and help us to forget the traumas, the stresses. And if we enter their world of play acting, play acting school, play acting going to the doctor, or playing cricket or some board games, enter their world. So unfortunately, many houses, what we see is parents are stuck in front of the television or stuck with their phones and are, right, go and play now, kids, go and play now, kids. And I mean, they're missing that opportunity to engage with their kids. Look, we are not going to have a huge amount of time to be with our kids. When they are 13, 14, remember, they don't want to talk to you. You're old. Mama, Dada, and they go out with their friends. So you have a small window as parents to enjoy their company, to be enriched by their company. And also, it helps us to relieve our stress to a great extent. Right? We can forget our financial worries. We can forget our COVID worries if we enter their play world. You need only a few cardboard boxes, some very simple toys, and the rest is imagination. Remember when we were kids, right? Reading stories for them at bedtime. Again, a very simple task. It's very easy to engage with them, and also engaging in healthy hobbies of our life. Social media is part of our life, but unfortunately, with social media coming up, people have given up healthy hobbies, like gardening, cooking, drawing, handicrafts, having a pet. There are thousands and thousands of hobbies which can bridge our relationships and also help us to handle our stresses much better. So use this opportunity. Don't force them to study all the time, right? So, I mean, unfortunately, our parents are either forcing us to eat or forcing us to study, right? Children can very well decide what they want to eat, how much they want to eat after 3, 4. And wasting our time to force feed them and then force study them or force them to study, it only creates negative emotions. We have to manage those to some extent too.
So what you're
We
saying,
don't have to do it all the time, right?
sorry, what you're saying is take this time as a blessing in disguise in a way to spend more time with your loved ones and your family, right? Play board games, make up stories, whatever. So yeah, so that's one way of looking at it for sure. Selvi, do you had some questions
quickly,
for Dr. Ganesh?
I just want a very quick question to doctor. So in an ideal world, doctor, we can do that. But here, my sister has died. I don't have income for tomorrow. I have a bill to pay and my child is wanting me to engage with the child. At what point do I take a pill to calm myself and do what you are recommending? What is the real honest stark truth out there for people who are experiencing a lot of mental instability?
Yeah, so it's like this, right? So unless somebody has a disorder, like anxiety disorder or a depressive disorder, pills have no place. There are no pills actually to reduce stress as such. Yes, I know. I mean, we always look for some pill solutions and we go to doctors and say, doc, I'm in stress or something. Very often what the doctors will prescribe are called benzodiazepines, and they make you sleepy and they are very addictive. So I don't prescribe that. and it's generally recommended not to prescribe it. So best thing is to make sure that healthy lifestyles, healthy relationships can take out most of the stress that we are feeling. Look for solutions for our problems. Yes, we don't have to look for solutions for our problems all the time. Some of the time has to be spent on looking for solutions, and at other times, kind of a diversions. And this is where kids can come very useful. Hobbies and kids can be diversions so that we don't think about our worries. So we need to have a healthy balance of thinking out rational solutions for our problems, and also not thinking of our problems all the time, and kind of diverting our mind to more kind of a happier, relaxing things as well. So yes, pills can have a place, but that is when you have a mental disorder like generalized anxiety disorder, something, but not otherwise.
Thank you.
Thank you. Thank you, Dr. Ganeshan. Selvi?
Okay.
Yes, doctor, I'd like to look at something very important. That is, I remember when this whole lockdown and the virus situation emerged, I think beginning of 2020 or maybe late 2019, I don't know. But I think there was a meeting with the government, with all the medical officers from the island. And I met a doctor soon after this meeting. And he told me, I don't understand. They say this is contagious, but the death rate is 4 to 5%. And I can't understand why they are taking all these precautions, because 4 to 5% is the normal death rate of any pneumonia or whatever, diseases that normally happen to us. So he was looking very perplexed after the meeting. I remember this so clearly because the psychosis, the fear that has been drummed up later on about this disease, it doesn't help people who get the disease when they have the fear psychosis. We have to counter the fear psychosis within us to work on our own physical and immune resistance, and to strengthen our mental and emotional, spiritual capacity to deal with the disease. But it is not there. And we have to decide that we will not be part of this fear psychosis. How do we do this?
Yes. Yeah, understanding the context is very important, right? So like every day, how many people die of heart attacks in Sri Lanka? How many people die of road traffic accidents in Sri Lanka? How many suicides happen in Sri Lanka? So because we are only looking at the COVID deaths and it looks like huge, right? So our response has to be appropriate to the problem. So having a knowledge of all, so if the government can publish like how many people died of heart attack, how many people, like you said, died of pneumonia or whatever, and then how many people died of COVID also, could put the knowledge in context. And so that is very important. So unfortunately, the negative messaging has become more prominent, partly because people have lost trust in the government's ability to put right information across. So the governments tend to mess around with the statistics, numbers to kind of show themselves in good light, which unfortunately creates a fear psychosis more. And like I said, the stigma that we have created around COVID. So for example, if I get COVID, there was a time when I would be shipped off to some faraway place and locked up in a camp somewhere, even if I had no symptoms, which is not a very sensible thing to do. Which made people to hide, which made people to fear that they are going to have COVID. So I'm dealing with people now who have had COVID and have recovered fully, and now they are having severe, depression, anxiety, serious consequences, where actually we need to admit him and treat him for their mental health issues now, but they have recovered from the COVID without any problem. So it's unfortunate that we have created this issue. and also about the vaccines as well. So unfortunately, there are a lot of negative messaging around it, which also is not very helpful. You're right. Yeah.
Yeah. You're muted, Sylvie.
Thank you so much. Thank you.
Yeah. So, Soraya, did you have a follow-up for Dr. Ganeshan?
Yeah, certainly. I wanted to ask about now our children, they're going to school. Not only have they been in a classroom, as Fazana said, they have not, so many children have not had access to computers and technology. And then shadowing all of that is this thing of death. Somebody they know, someone who is close to them or close to someone they know has died. What do we tell them? How do we guide them to heal? Because it's not only the question of education, but healing for our children, for the next generation. They have gone through so much trauma, and I'm not sure if the governments are ready to provide that kind of trauma care for our children and parents. What do you tell a child about death? How do you console the child?
So important thing is children at the age of 3.5, 4 can understand the concept of death. So we have to be truthful to the children and tell them. So unfortunately, in our cultures, there is a kind of a tendency to hide the children, not to tell them that so and so has died, because we think, oh my God, they are going to be upset about it. If we don't tell them, that is going to upset them more when they get to know at some point, right? And also, if we can learn this resilience to cope with death at a younger age, it's very helpful to us when we grow up. So telling the children the truth is very important. And also telling the truth in a contextual manner. Okay, so that uncle or aunt died of COVID, the COVID virus is most of the people are unaffected by it, especially children are mostly asymptomatic. So that person died because they had some other diseases. So telling them the whole story, the whole truth is very important. Just saying they died and allowing the child to imagine all sorts of other things is not very helpful. You know, children have like very vivid imaginations, and very often they will tend to imagine, oh my God, my parents might die, etc., etc. I might get sick or something like that. So making sure they get the full information. So
Sorry.
that torture children ask questions, right? They are going to come up with those questions. Don't say, no, you won't understand. Go and play now. Don't try to distract them. When they ask questions, spend time, be truthful, and try to give them the right information. It's very important, right? So these are some of the things.
Ganeshan, sorry, I hate to go back to this story, but one of the key things I find, having been in the situation, is the inability to say your goodbyes to loved ones. For instance, if somebody gets COVID and they're serious, they're taken away to hospital. Family members are not allowed any contact whatsoever. Now, in other countries, they're allowed to come to a certain waiting room and, you know, have some kind of interaction, or even to say their goodbyes when they know that their loved ones are not going to even make it. I mean, we didn't even have a call back from a doctor to say that, you know, our loved one had passed away. I mean, you heard it from a third source. So how do, can you give some tips on how people, you know, this grieving motion, right? Closure, these words that we use, you know, to have closure to what happened. And how do you personally grieve? You can't get together and have a memorial service. You can't go to the cemetery and say your byes. You know, so many restrictions. So how do we heal from all of that? What are some of the ways we can actually address going through the motions of grief?
Yeah, so that's a very difficult thing, you know. I mean, grieving is very important, and grieving is important so that it reduces the suffering later on. And you know, looking after the caring for the loved one, being there care for them, giving them some water, massaging their backs and legs, and those things all help in the grieving process. And saying goodbye and all those things are extremely important. But unfortunately, as you said, we are not in a position to do that during the COVID times. And also, our investment in our health service has been quite minimal. Our health service has been running on shoestrings. Unfortunately, as a country, over the last 30, 40 years, prioritized, and health services were neglected very badly. Even comparing to our neighboring countries, our investment in the health sector has been quite minimal. And it's going to come at some point to bite us. And during the disasters like this, when the service is overwhelmed, its capacity to cope is not there, right? And it shows the lack of investment we have done over the years. Yes, there was a time when we were living in like mud huts, attached roofs, and hospitals were working at a particular standard. And hardly anybody is living in that sort of housing now. But unfortunately, our hospitals have not upgraded because of lack of investment. And this is not just the buildings, but overall the services as well. The other thing is about the communication between the health service providers and the patients and the family always has been a big point in our service. Because unfortunately, people think whatever they are getting, they are blessed to get it, and they have no right to complain. And unfortunately, our civil society has been very weak in voicing the patient's rights and the client's rights. And of course, people pay taxes indirectly, and that is how the health service runs. People don't know that, and we make sure that we don't tell them that. So they are used to a crappy kind of a communication system. Very often the nurses, doctors, support staff have very poor styles of communication. And overall, as a country, as people, we have accepted it, and that's our mistake. So civil society has been very weak on that. So that is one of the problems. And also, if you take the support staff in our hospital who carry out most of the communication with the patients and relatives, have hardly any training, and most of them are kind of for a better word, political appointments, and it's managing them has been a huge struggle. So that is also another issue. Professionalization of the support staff group is also very important. And unfortunately, the unions in the health sector have become very powerful. And patients' well-being is not necessarily in their forefront of thought, though they may say that they think about and they work for the patient's welfare. That is not their interest. Their main interest is to look after the well-being of their members. And it's the state that has to, and the society has to look after the patient's rights. Yes.
Dr. Ganeshan, unfortunately in Sri Lanka, I think the bedside manner of most of the doctors is nil and none. And, let's face it, that's what it is. And most people have accepted it. I mean, I talk to people who are laborers and farm workers and whatever, and you ask them, what is the disease? What did the doctor say? They said, well, they didn't say anything. They just said, I'm sick, and they gave the medication. So they are not even informed as to what they actually have. They're just medicated and sent off. So in a way, doctors look at themselves as gods almost. And as you said, what they tell you, you have to do, And so that is really one of the areas I think we really need improvement. And if they are very busy during COVID, then as you said rightly, hospitals have to take it upon themselves to have a spokesperson who talks to the family, somebody who's sympathetic, somebody who's caring, somebody who has empathy, not just somebody who calls and say, hey, you know what, your loved one died or passed away or didn't make it. you know, and here's the bill you have to pay before you can take the body. This is what I have heard from people. People who can barely afford it have been taken to private hospitals, not with their consent, but just because they've been told there are no hospital rooms available, and just put it in a private hospital, and they've been told you can't take the body out, even if the government has said 24 hours, within 24 hours you have to take care of it. They don't release the body, saying you have to find the money. I know families who have actually had to hawk everything to pay the bill to get the loved one out, the one they can't even see, the one they can't even say bye to, you know, and it's the one who's automatically processed. It's such a terrible thing to happen, you know.
I think,
on that
Carol,
note, there's a message from Roseanne here. I just want to say, I think, Roseanne, we have covered it, if I'm not mistaken, because she asks about untreated, unprocessed trauma being exacerbated and triggered during lockdown and isolated. So I think, Dr. Ganeshan, you have touched on that a little bit. Unless you want to expand a little bit on it?
on just what you said, Carol, I think our listeners, let us make a call out there that they demand better etiquette from our healthcare providers. At least the private hospitals should begin doing this, and let's get to the government hospitals. That's
that
you.
is definitely, there's a group that was trying to fight for patients' rights.
Okay.
And I think they really need to move and get this policy gazetted. You know, otherwise there's no way they can deal with it. Maybe I need to talk to, I know the lady who's been fighting for this for a few years now. You know, Riley had another question saying, doctor, could you please recommend how to improve our sleeping patterns for better mental health?
Okay, good. So there are some simple things that we can do. One is fix a time for waking up, right? And don't change it, whether it's weekend or whatnot, right? Second, have a good kind of a preparation to going to bed. That's again important. Have an early dinner. Watching YouTube videos or television just before going to bed is a bad idea. You know, lights prevent us from falling asleep. And when we watch YouTube videos or television, it's moving lights. And so it's difficult to fall asleep for about 1.5 hours after watching something. So if you have a bedtime, at least 1.5 hours before that, stop watching YouTube or videos or TV or whatever. Do that much earlier. Have some malted drink, you know, like Nestamol, Protein X, Maltova, whatever, just before going to bed. Make sure the bed is comfortable. Make sure the room is very dark. Make sure the temperature is reasonably good. There are no major lights coming from the windows or whatever. So these are some of the things that can help us. Having an early dinner is also helpful. So simple things. Exercising regularly, it's very useful, but don't exercise just before going to bed. Then it's very difficult to fall asleep. So at least exercise 3-4 hours before your bedtime. So these are some simple things. These are called sleep hygiene. You can read it in the internet also. There are simple things that you can do that will help us to sleep.
Farzana, you had a question? Farzana, you're muted.
Your mic is mute.
Yeah. No, I mean, I just feel the problem is so complex, right? And there's a multitude of issues. Like I asked about children, I wonder about teenagers too, who are at that age of puberty, and it's a different age where they rebel, and they're also stuck in the house. And I'm wondering if the more spiritual path would be the answer, where a lot of yoga and meditation, because like you said earlier, there is no pill to be taken for all these things, right? But all this put together, like we all discussed now, the financial issues, the lockdown, finding deaths in the family, everything get together is so complex. So that's why I feel it's a bit overwhelming, right, at this point. So
actually, I'd like to add to Farzana's question about children, because doctor, your specialty is gender-based violence. I mean, children stuck at home and women stuck at home. We have information, at least from the UK, that the gender-based violence has escalated. How do we manage this situation at home? particularly when we can't leave.
That's an important problem. Even in Sri Lanka, anecdotally, we understand that the gender-based violence, domestic violence has increased. So it's very important that, as we said earlier, to understand that we are under stress. Understand that it's a very stressful situation, and we are going to be more irritable, and the stress is going to make us more violent and be very careless with our words, and learn to be careful not to hurt the other person. And also, when we get angry, move to a corner where you don't, the anger lasts 5 to 10 minutes. And if you manage that 5 to 10 minutes, most of the time the anger kind of settles. But unfortunately, in that 5 to 10 minutes, we say things and do things that kind of creates a chain reaction, which aggravates the situation and makes things worse. So the moment I understand I'm in a bad mood, it's best for me to tell to my spouse, hey, I'm not in a good mood now, I had a bad day, and just make the other person aware that I'm stressed, I'm in a bad mood, just give me some space, right? And just communicating that to our partners, even to our children, they will understand, hey, dad is having a bad time, don't, give me some time, half an hour, I'll come back and talk, answer your questions or come to play with you or something like that. It's very useful. So for that, we have to connect with our feelings and understand that I'm under stress, and then need to learn to communicate it without getting emotional, without shouting, without screaming. Say that, hey, I'm under stress, just give me some space. So that itself can make a huge difference. And also understand, just like I am under stress, the other members in my household are also under stress. The husband is under stress, the wife is under stress, and like you all said, the children are under stress. So it's not just me, it's everybody's under stress. So getting our stress out on other people is not going to help at all. So we have to find healthy ways of managing our stress. So like you said, meditation can be a part of it, exercising, healthy hobbies, creating positive spaces in our houses. So we have to do these things and improve our well-being of our families. And that can be done. That can be done.
Yeah, I think I'd like to just follow up on this this spirituality as a solution, taking into consideration the complexity of the situation and the amount of stress we are facing. Do you think that this like meditation, japas, prayers, all of those practices would help a lot for us to emerge from this predicament at the moment?
Yes, definitely. But important thing is not to force people to do that, right? So some people come and ask me, Doc, my child is 10 years old and is under stress. I'm asking her to meditate, but she's not meditating. A 10-year-old asking to meditate, in a way, it's not fair, right? So forcing people to meditate is not necessarily a clever thing. But yes, we have a problem in front of us, and we have to find solutions for that. That I agree. But thinking of the problem all the time and looking for solution all the time is not going to be very helpful, because our brain is going to get tired, right? So we need to put aside our problem and do other things, at least part of the time, so that our mind can relax, calm down, and then come back with a fresh mind to face the problems. And definitely meditation, spiritual activities can be of help if that person is inclined towards that, if they find them very useful. So forcing that on people is not necessarily a healthy thing.
Thank you, Dr. Ganeshan. There was a question from Shaza about what can teachers do to ease up the situation for the kids. I suppose this is the same answer that you would give, to organize their study even as a play kind of thing, because obviously these kids are going through a time that we didn't understand. But then on the other hand, we went through war, 30 years of war growing up, our kids did. So I suppose it's in a different kind of war that's happening at the moment. On that,
Carol, is there time for a last question?
Yeah, please go ahead.
Okay.
We'll have a quick question.
Quick one. So is overthinking the cause of mental disorders, or is it chemical imbalances, doctor? And some last thoughts for us.
Okay, it's a mixture of everything. Like overthinking about anything is not going to be very helpful, right? So we have a problem. I mean, it can be COVID, it can be any other problem. And we have to think about it. We have to move towards solutions of coping with those problems. But thinking about that all the time is not going to be very healthy. If we overthink about something, again, our chance of getting into a disorder is going to be higher. It's not that I'm not saying that you will get into a disorder, but if we go on overthinking about anything, right, it can push us towards a disorder. So we have to think about it, but we also need space and time not to think about it. And balancing that is something that we have to learn.
Thank you so much, Dr. Ganesh. And we are actually very, very grateful to you for having agreed to come on air with us. And I think it's been very helpful to our listeners. Thank you so much. And I would just want to leave you all with a thought, never before has any time in our lives has it been this important to love and be loved, to enjoy every minute of every day. COVID has brought home that all we have is in life is that it's too short. So to live every minute of it and be happy or make someone else happy, have empathy for others. When you start thinking about how bad things are for you, look out there. There are people who are in much worse conditions than you. And money, fame means nothing. It has shown, COVID has shown that, you can have all the money in the world or no money in the world, and you are pretty much in the same situation. So, if you accumulate wealth and you do all these things, it's not going to get you a better place going out of this world. So on that, thank you so much for joining us. Our next Wisdom Wednesdays or Wisdom Wellness program is on the 22nd of September. Join us then. And from Selvi, Soraya, Fazana, myself, and Dr. Ganesh, and of course, good night and thank you. Stay healthy. Goodbye.
Thank you, Dr. Ganeshan.
Can't see the screen, Carol.